Hi all, in this video we'll see about pancreas histology and its forensic histopathology. So these are the contents that we'll be discussing today. We'll see about from basics to the forensic implications. First, we'll see about introduction to pancreas, its histology, recurrent resemblance to which will be confusing the pancreas and its forensic implications. So introduction to pancreas. So the pancreas is a soft, finely lobulated, elongated exoendocrine gland. The exocrine part secretes the pancreatic juice and the endocrine part secretes the hormones like insulin. The pancreas, it is a Greek word which means pan, all, and krias means flesh. So it is presumably named so because of its fleshy appearance. So the pancreatic juice helps in digestion of lipids, carbohydrates and proteins, whereas the pancreatic hormones maintain glucose homeostasis. So let's see about the introduction to pancreas, its parts. So first is the head. The head is located within the concavity of the duodenum and comes the neck part. So as you can see from the pointer, so this is the head part and the constricted portion is the neck part. Okay. So the neck part is a constricted part and the body part which forms the major bulk of the gland, and this is the tail part. Okay, so the tail part will be related to the hilum of the spleen. So where it is located exactly, as we can see in the picture only, it is extending from T12 to L3 level. So the pancreas lies more or less horizontally on the posterior abdominal wall in the epigastric and the left hypochondriac regions. It crosses the posterior abdominal wall obliquely from the concavity of the duodenum to the hilum of spleen as we discussed, and opposite to the level of T12 to L3 vertebra. The greater part of the gland is retroperitoneal behind the serous floor of the lesser sac. Its left extremity, the tail, lies in the renal ligament. So next we'll see its cross section. So these are the parts that we discussed actually in the previous slides. We can see the head, the constricted neck part, the major body and the small tail part. Okay. So then in cross section, like if we cut like this, it will appear somewhat triangular like this. Okay. So in cross section, it represents three borders, the anterior, superior and inferior, and three surfaces, the anterior, posterior and inferior, and then one process, the tuber omentale. So we can see here the tuber omentale. A part of the body projects above the lesser curvature of the stomach and comes in contact with the lesser omentum across the lesser sac. So next we'll see about the histology of pancreas. So the microscopic features, the pancreas has three components, the stroma, parenchyma and the duct system. So the stroma, the gland, is usually covered with a capsule of connective tissue. From this capsule, numerous septa arise which divides the parenchyma of the gland into lobules, and the parenchyma has exocrine and the endocrine parts. So the duct system carries the excretion of the exocrine part into the duodenum. So this represents the exocrine and the endocrine part of the pancreas. In exocrine part, we can see the serous acini and the zymogenic cells, and in the endocrine parts, we can majorly see the islets of Langerhans. So this represents the exocrine part only. We'll now jump into the exocrine part of the pancreas. So as we said, it mainly consists of serous acini, which in turn has zymogenic cells, and these are arranged as lobules and they are connected by connective tissue and they are drained into the interlobular ducts and they have the blood vessels. So now this represents the slide of the pancreas. As we see from here, the exocrine part of the pancreas is represented by many serous acini. This is one serous acini, this is one serous acini, this is one serous acini. So these are darkly stained, and whereas this is the islets of Langerhans, which we'll deal about later. So now we'll first jump into one serous acini. The exocrine part of the pancreas formed by serous acini is arranged into many lobules. The lobules are separated into interlobular septae of connective tissue which carry the neurovascular structures and ducts. So we'll jump into one acini here. So each acini consists of the pyramidal cells. So these are the pyramidal cells here. Okay. These are the protein secreting cells that surround a small lumen. The ducts are visible as centroacinar ducts. The intercalated ducts, whatever the ducts, which enter into the acinus inside the center, they form the centroacinar ducts. And the secretions leave via the intralobular ducts to the interlobular ducts. So each acinus is made up of pyramidal serous cells with a small lumen. These cells are actually the darkly stained at the base. See, as we see, darkly stained at the base and light at the apex, which have the Zymogen granules. They are small granules. There are no myoepithelial cells. Instead, there are myofibroblasts-like cells called pancreatic stellate cells found encircling the base of the acinus in the periacinar connective tissue. So some acini exhibit pale staining centroacinar cells within the lumen. So the first we see the centroacinar cells. They are cuboid. See, these are pyramidal, whereas the centroacinar cells are cuboidal in shape and represent the intraacinar part of the intercalated duct, which instead of arising from the periphery of the acinus has invaginated into the acinus and starts from inside. The intercalated ducts drain into intralobular ducts, which in turn drain into interlobular ducts and are lined by simple to stratified cuboidal epithelium. The interlobular ducts empty into the main pancreatic duct. So this is a quick representation of the serous acini. Each grape represents the acini and the interconnection between two grapes is represented by the intercalated ducts. They are further connected with each other by the larger intralobular ducts. So this is a quick representation of the acini. So while cutting the grape, we can see the cross section like this, and this represents the pyramidal cells that is having darkly stained the base and with the apex with the zymogen granules. Okay, so next we'll see we again came back to the same picture because here we are going to look into the endocrine parts. This represents the islets of Langerhans. This one, and this one. So these are the pale stained areas. The endocrine pancreas is formed by islets of Langerhans, which appear as pale stained spherical bodies among the serous acini. They are more in the tail region of the pancreas. There are about 1 to 2 million islets in the pancreas. They are made up of branching cords of endocrine cells of the following types like alpha, beta, and these are the endocrine cells alpha, beta, delta, and the pancreatic polypeptide cells. So these are supported by the reticular fibers. Now we'll jump into the endocrine part, islets of Langerhans. So these are the constituents of the endocrine part. They consist of alpha, beta, delta, and the pancreatic polypeptide cells. Actually, these cells are not clearly visible to the eye, even through the microscope, but they just represent some cells. They represent like majorly we can see insulin cells with a special stain only. Actually, to the normal H&E slide we cannot identify these alpha, beta, and delta cells. So alpha cells are 20% of the population. They are large cells with eosinophilic granules. They are mainly present in the periphery, alpha periphery. Okay, they secrete glucagon. So beta cells, beta center, alpha periphery, beta centers. Okay, So beta forms 70% of the population. They are small cells with basophilic granules and are mostly found in the center. They secrete insulin, which decrease the glucose level in the blood. And delta cells form 5% of the population. They secrete somatostatin. So then we come to the F cells or the pancreatic polypeptide cells. They inhibit the pancreatic secretion. So these are the cell types. As we have already told the percentages, main constitution is by the beta cells which secrete the insulin. So here, this represents a diagrammatic representation of the islets of Langerhans. So this actually appears as a pale staining area in the section of pancreas. So here we can see many cells, that is 70 to 80%, as we discussed in previous slides. No, these are represented by the beta cells. The beta cells are in the center, and the alpha cells are in the periphery, and then other cells are very minute in number, so we can't see here. So this is the islets of Langerhans. They are pale stained spherical bodies. They are 1 to 2 million islets in number, and they are more present in the tail region. Okay, and these are having endocrine cells, that is alpha cells, beta cells, delta cells, pancreatic polypeptide cells, supported by the reticular fibers. So next we come into the endocrine cells. As I've already told, we can't see these four cells with the naked eye or whatever the H&E normal staining. A special stain called as immunoperoxide stain can help identify these cells. So as we see in this image, the periphery cells are present. So this represents the alpha cells, and in this image the center cells are highlighted. So this represents the beta cells. So this represents a pancreas light, and which what features we can identify the pancreas is that there are four highlighting features. First, the darkly stained the serous acini. So here we can see the serous acini. Acini, these are darkly stained serous acini, and lightly stained islets of Langerhans, and presence of centroacinar cells. Okay, while the intercalated ducts drain through the acinus, we can see the inside part of the acinus as centroacinar cells, and there is absence of striations in the duct. So now this is a slide of pancreas. Like we can see the pale stained islets of Langerhans, this one, and all. And these are the reticular fibers. And this is the pancreatic acini interlobular septum. So this is actually a slide that we got from our anatomy department, and this represents the pale stained endocrine part, islets of Langerhans. So what slide we confuse this pancreas is that we confuse it with the parotid gland. So this is the pancreas, this is the parotid. How am I saying so? This is because there are few findings, okay, that are different, okay. So first, in pancreas we can see the pale stained islets of Langerhans, but here we don't see any such findings here, okay. And then we have the centroacinar cells in the pancreas, and there are no such finding, but rather we have the large adipocytes. As you can see here, the white cells are the adipocytes that are abundantly found in the parotid gland. And then there are no striated ducts in the pancreas, whereas in the parotid we have the duct, and within that there are striations. The parotid gland has appearance similar to pancreas, but abundant adipocytes in the glandular stroma, and the endocrine islets and centroacinar cells are absent in parotid. So this back image is actually the parotid gland with the striated duct, intercalated duct, and serous acini. There are no centroacinar cells. Okay. Next, forensic histopathology. So this represents a slide of type 1 diabetes mellitus. So this image shows insulitis of an islet of Langerhans, like it is belonging to type 1 diabetes mellitus patient, and there is presence of lot of lymphocytic infiltration in the edematous islet, suggesting an autoimmune mechanism for this process. The destruction of the islets leads to an absolute lack of insulin that characterizes the type 1 diabetes mellitus. So there are no insulin left behind, so they can result in ketoacidosis because the muscle tissue shifts from glucose to lipids, which the resultant usage of fatty acids and generation of keto acids. The energy source has been shifted. Next, type 2 diabetes mellitus slide. Here we can see the islet of Langerhans, but there is pink hyalinization as I have marked in the arrows. There are a lot of pink hyalinization or deposition of the amyloid in many of the islet cells. This amyloid contains protein derivatives of amylin, and amylin is secreted in small amounts at the same time as insulin and shows a rate of rise of glucose in the blood. However, like in type 1 diabetes, total islets of Langerhans is damaged, but in type 2, there is a sufficient remaining beta cell function to prevent ketoacidosis. So next, this is a case where a 27-year-old resident doctor in internal medicine died suddenly. So actually, he had symptoms like abdominal pain and all, but he mistook it for gastritis and he self-medicated. And then he was in a night duty that day, and that time he had single episode of vomiting at 9 p.m. He skipped dinner and he went back to his resting room and on duty to ICU, he attended to patients until 2 a.m. And at 4 a.m. when he was awakened, he was not able to get up, and then he was declared as dead at 4 a.m. And then this happened in a college actually, so they did a post-mortem for this person. So these are the findings. Actually, this person, he was not any alcoholic or he didn't have any comorbidities, and the autopsy finding did not have any external injuries, and all the organs, brains, lungs, kidneys, spleen, liver, showed congestion and edema consistent with shock. So special emphasis was made to pancreas, like it weighted 110 grams. It was all pulpy, friable edematous with frank hemorrhage. On cut section, there were hemorrhagic infiltration, and histopathology slides were slant actually from many organs, but the positive findings were from pancreas. It showed a total hemorrhagic necrosis of the pancreatic parenchyma extending into the peripancreatic adipose tissue. So, the cause of death was then found to be acute hemorrhagic pancreatitis that was discovered only at autopsy. So, this represents the slide of the person. So, this one represents a hemorrhagic necrosis, and this the peripancreatic adipose tissue, and this represents the necrotic parenchyma, and then inflammatory infiltrates. So this is actually acute pancreatitis case that we did it on the autopsy. This person was a middle-aged man. He suddenly collapsed. He had breathing difficulties and then collapsed. And he was rushed to the hospital. Before which he was on arrival of the hospital, he was declared dead. Represents the slides of the patient. Here we can see a lot of lymphocytic infiltrate between the acini here and here. So this represents the acute pancreatitis. We see the slides of this patient. Uh, so these are my references. Uh, Thank you and subscribe for more content.